be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.
Evening, everyone. Welcome to tonight's Lung Cancer Living Room. So happy to see all of you here, some familiar faces and some new ones. It's always a pleasure. My name is Danielle Hicks. I oversee patient services at the foundation. Some of you may or may not also know Bonnie J. Adario Lung Cancer Foundation has very recently, within the last 6 weeks, merged with the Lung Cancer Alliance. So we are now Go-To Foundation, which what that means for you guys is we are literally the go-to place for any and all of your needs outside of your obvious clinical care team. We're very, very excited about the merger. We have more patient services to offer. We have more options for research, more options for development and fundraising, and all the things that need to happen in order to ensure that we can get approvals and new things happening in this space so that Dr. Reyes and team can bring them right back to you. So that's a little bit about who we are. So I'm going to ask the panel to introduce themselves, and then I will do a little introduction into the conversation tonight.
Hi, I'm Dr. Domingo. I'm one of the lung cancer specialists working at Memorial, along with Dr. Reyes.
Oh, my name is Dr. Luis Reyes. 22 years ago, I decided to dedicate my life to fight lung cancer, and it has been a long journey, very intense. I suffer with you too. It's not easy for me to see. But I also am very happy for all of you when we have success stories. And I get the congratulations and the accolades, but as many of you have said, it's a huge team, So I am very lucky to have Dr. Domingo that works with me, Dr. Brian Hunis that is not here, Dr. Atif Hussain, Dr. Whitling. We have a lot of doctors at Memorial that works with us, and then we have the surgeons like Dr. Tarasi. We have navigators like Michaela. We also have here our other navigator, Alba Baglietto, that is in the back. We have Paola Izquierdo, is our nurse practitioner. We have Marai Salina, is our director of support services. We have John Brown, is our administrator that takes care of our lung cancer team. It's a huge team. It's a multidisciplinary team. And without the team, we cannot do anything. That's why I always get the accolades. Honestly, it's a big effort. It's a big effort. I don't know how many we are. Maybe we're 20 people, 25 people that fights lung cancer for you. Not only in our institution, Also, you mentioned Dr. Santos, Dr. Santos and his team in Boca Raton does a great job. We have Dr. Mudad and Dr. Johansen, University of Miami, Dr. Estela Mari Rodriguez that was here last year in Mount Sinai. We will have all these multidisciplinary teams, and tonight we're going to share a little bit of what we do. And we fight for you, but we also need your help. That's why we're here. Advocacy is very important. We need more funds for lung cancer research. And we have now the Bonnie Adario Lung Cancer Foundation. We have the Lung Cancer Alliance. Now we call them the Go-To Foundation. We need your support because we need more money, more funds for lung cancer research. As you can see, many of you are alive thanks to target therapy, thanks to some pills that we have now because we have discovered genes and we have targets for these genes. We only have treatments for 5 genes, and there are 70 genes that we can isolate in lung cancer patients. So we have many more treatments for more genes. So instead to give you empirical chemotherapy, we can give you what we call precision medicine, one treatment for each patient that works. And then 10 years later, we have a great successful story. That's why everybody that is watching online or watching in YouTube, we need more support. We need to support these lung cancer advocacy organizations. And I guess you are the patients and the caregivers. You know, sometimes when I talk about this, they say, "Oh, you are the lung cancer doctor, but you don't suffer." They listen to you. That's why we need your help, and you need to fight together. No?
Good evening. My name is Mijaela Roldan. I have been a nurse for the last 8 years with special interest in oncology. I have geared my career to help patients from the research standpoint, and for the last 2 years, I have been a navigator, helping Dr. Hunis, Dr. Sarsfield, and Dr. Hirsch to help patients with lung cancer and head and neck cancer. I'm very passionate about my role as a navigator at Memorial Cancer Institute, and I feel like I have found my calling to help patients like you. Thank you.
My name is Francisco Terrazzi. I'm a thoracic surgeon at Memorial, part of Dr. Rice and Dr. Botero's team. And we dedicate our practice to benign and malignant conditions of the lung and do the lung cancer surgery at Memorial.
So thank you all for your introductions, and I just want to reiterate something Dr. Reyes said about this team at Memorial. And we've been working with them for several years now, and I'll never forget the first time we came out to meet with her, and we met with the entire team, and it was very overwhelming walking into that room. But I can tell you that what he says is absolutely true. Everyone there, the care team, right down to the administration, is behind this program and in this team. So thank you all for everything you're doing. Dr. Botero, you didn't get to introduce yourself. I'm sorry.
That's okay. I recognize a few faces. I'm Dr. Botero, Ana Botero, Radiation Oncology, and I work with Dr. Terrazzi, with Dr. Rice, with Dr. Domingo. I think that we're all the same team, and it's always a pleasure to be here just sharing your experience with a little bit of our knowledge. So thank you.
So I'm going to turn it over to Dr. Reyes in a minute. We're going to be talking about precision medicine tonight, what that looks like, what that means, one treatment for each patient. We're going to touch a little bit on early stage disease, move on to locally advanced, and then metastatic disease and how each of those are treated in a precision way. But I want to start a little bit first, if you don't mind, Dr. Reyes, and talk a little bit about screening, which I know is not necessarily relevant to anyone in the room, right? You've already been diagnosed, but you know people, right? And so being the voice out there on the streets and in your neighborhoods is really important to let people know who qualify that screening is an option for them and that they should really do it, because when we do find it early, we're going to talk a little bit about that next. But if we could just start a little bit with screening, if somebody, maybe Dr. Terrazzi, I don't know, wouldn't mind running down a little bit of the qualifying criteria so that we could educate everyone in the room and everyone watching on who they should be talking to and whose doors they should be knocking on.
Yeah. Well, the lung cancer screening has significantly changed, lung cancer, because when, as probably all of you have heard, there is screening for colon cancer, there's screening for breast cancer, screening for, prostate cancer, and there was nothing for lung out there, and people rely on a chest x-ray. They found out, chest x-rays are not as good. You could miss things in chest x-ray. And then they started looking at CT screening protocols, and when the trial came out, it was published in the New England Journal, the outcomes were so good, so great, that it was closed early because it was not fair to randomize people. And it saved more life than, if you just screen lung cancer, you can save more life than all the other cancers combined, all the other screenings combined. And it's not only important because you save lives, it's also important because in the economics, when you look at the people that look at the economics of healthcare, which cost and benefits, also diagnosing early and making early stage diagnosis and curing those patients also impact healthcare in that way. So who qualifies for that? People that is over 55, people that are either former smokers that quit, within, I think it's 15 years of people that is actively smoking. And what is screening? It's just a low dose CT that you get enough radiation to find an abnormal spot in the lung. And then once you find that, you can move on to a more specific testing. And most of the lung cancers, as you know, as is today, they get diagnosed late. You know, only probably 25 or less % of the people get diagnosed as stage 1, which is the earliest, and the one with the highest cure rate. 75 plus get diagnosed as stage, you know, late stages, either 3 or 4. So it's important to make people aware and promote the screening, because the amount of lives that can be saved is tremendous. And the other point that is important to bring up is a lot of places are jumping into screening protocols, and it's very affordable. I mean, I think Memorial is doing it now for
$50.
yeah. I think it used to be 100, now it's even 50, and that includes a reading. I mean, there is a lot of issues down the road to set up a program for that, but we're actively working at the system to come up with our own screening program. I mean, we do the test, and we're trying to set up the screening program. We now have a full-time dedicated person to look at that and run that program, but we're in the process of setting it up.
Thank you. I really like the idea of well, everybody here was mentioning how grateful they are to Dr. Reyes and all the team for the help and support that you guys have provided. And I really like the idea that you mentioned of us helping you help us. So one thing that I was thinking about was, for example, a part of gratitude is not is what you say, but more what we do. And so I'm thinking about how I could help, how I could put my part in helping not just myself, but everybody else going through scenarios like that. So I'm thinking like maybe I could do something like a tithing to foundations like the Bani Dario Foundation that help support the research that goes into all these great immunotherapy pills and procedures that help us. And I'm wondering if you guys had any advice on. Yeah, I'm only an individual, so there's only so much I'd be able to give. So I'm wondering if you guys had any helpful insights on strategies that we may be able to use, and this will go to you, Dr. Reyes, and also you, Daniela, for to see how we may be able to maximize donations being given to research that essentially help us.
Well, you can do much more than what you can imagine, because if you, I don't know if you're aware, but Boni Adario Lung Cancer Foundation started with one patient. Boni Adario is a patient. She survived lung cancer with a huge surgery, that saved her life, but she's a patient. Maybe one day she was like you, saying, oh, what I can do myself, but that's exactly what we're trying to empower you guys. You can do a lot, You can do a lot because it's your testimony. Every time that I talk about it, they say, yeah, you're talking about, but it's not you. But when you talk, you're talking about your own life. And something important that they were mentioning in the back is that we have 30,000 Americans that get lung cancer that have never smoked. Yeah, the other 180,000, they said, oh, they did to themselves, they smoke, it's their fault. First of all, I think it's wrong, because when you get diabetes because you go to Burger King, if I'm not going to give you therapy for diabetes because you went to much Burger King, you cannot start to judge people. If you get a heart attack because you're eating too much donuts or whatever, if you want to start to judge people, you don't treat anybody. Yeah? But anyway, you have 30,000 Americans that never smoke, and they get lung cancer. That's more than the whole number of non-Hodgkin lymphomas. You only have 8,000 Americans getting Hodgkin lymphoma, So lung cancer or non-smoker is a whole disease by itself. And you guys got the lung cancer, who knows for what reason that we don't know. So that's why it's very appealing, all of you that are non-smokers that are here, because that raises the level of awareness. And as I said, to give you an idea, the Department of Defense started to give funds to fight cancer, the Department of Defense. And I went 4 or 5 years ago as a reviewer. We got assigned $20 million for molecular markers. That was the time that we started to discover the molecular markers that you guys have. They gave us $20 million, but they gave for breast cancer $250 million. $250 million. And lung cancer kills 80,000 women. Breast cancer kills 40,000 women. And lung cancer kills another 80,000 males. Yeah, that's why I'm not having anything against breast cancer. It's disproportionate. That's why we need your help. We need your testimony. We need your advocacy. What you guys can do is you can go inside this organization, Lung Cancer Alliance, go to Foundation, Boni Adario, Free to Breathe, all of this, and try to help us. Try to help us raise awareness, try to help us do fundraising, bring your family, bring the caregivers. That makes a difference for us.
I think that we're touching a point that is very important is why do we see football players wearing pink? Why do we see license playing pink? And it's not because breast is more important than lung cancer. I think that traditionally lung cancer is has been a killing number 1. Instead of that, breast cancer, for many, many years, we have the mammograms that is early detection, highly, more rate of cure. And you see a lot of survivors of breast cancer speaking, talking, collecting fund, doing fundraisers. And if it's not creating something like this, that is amazing, but it's very difficult. Just kind of at least doing their own things in their own communities and helping raising funds and awareness. Awareness is the most important thing, I think. But on the other hand, now with all this new precision technology, surgery, chemotherapy, target therapy, immunotherapy, radiation therapy, being more, precise, we're seeing survivors. And at the beginning, I remember when I started working with Dr. Rao, how many years ago? Many years ago. And I remember that he was at UM and I was at Memorial. And eventually he moved, and we started figuring out that not everybody needs chemotherapy, not everybody was a death sentence for a stage 4. I decided not to give whole brain, that it was like a big thing, and treat with stereotactic radiation, that is, again, precision medicine. And we start noticing, without no reports in the literature, that the patients were surviving. And I said, what is this? We have a patient that survived 5 years, 6 years, stage 4, from moment 1 of diagnosis. So I think that the main point is that now, with all the new things in medicine, thanks to the pharmaceutical companies, societies like this, groups like this, the American Lung Cancer Society has tons of activities. I can tell you because I'm in the board, and every 2 months we're collecting money, funds, people, awareness, speakers, events that involve the community that collects money. And we see more and more survivors. If the survivors stand up and talk and make more awareness, I can guarantee that not only we will have better results, but little by little, it's a matter of changing your environment, your close network, and participate. You don't have to reinvent the wheel if you don't have the time, the energy, the money, or whatever. But if you join the effort, it makes a difference. It really makes a difference. That issue of, the money will go for whoever is, the director, and the money goes someplace. Little by little, we're making difference. And this is the proof that making difference. All of you, that you're here. Because cancer, lung cancer, it was killer number 1. We used to diagnose the patient and think in our minds when we were just saying, whole brain, okay, in 3 months I'm not going to see you, how I'm going to make this patient comfortable. That's not the case now. When I see a patient that is a stage 4, I said this patient could be among that 20 or 30% patients that is going to be alive in 10 years. And maybe at some point, they might think that we're crazy, but we can tell the patient at stage 4, you're going to be cured. Not for everybody, but it might be for some, and that's what we have to figure out, which patients are better than other candidates for certain therapy, and basically be very precise what type of therapy and how we're going to treat that patient. And unfortunately, we're humans, And some patients cannot be saved, and it's not for lung cancer only. And as a physician, we have to help them to die with dignity, But in general, there's a big things that we can do. Every single person, every relative, is not like I can do nothing. We always can do something. Minor little things or major things, but we can create an impact, any level.
I can also take advantage to talk about navigation. I want to introduce Michaela because I think as we are talking about the importance of the multidisciplinary team, I think it's important that we use all of these resources. So in the Bonnie Dario Lung Cancer Foundation, we have lung cancer centers of excellence, and we require that every hospital or healthcare system that wants to be called a lung cancer center of excellence have a lung cancer navigator, because the lung cancer treatment is very complex, and we need somebody to orchestrate all of the care so the patient doesn't have to wait 2 or 3 weeks to see each doctor, Can you say a couple of words?
Good evening again. I put some information together, so hoping that my message will get to you. Every time you have questions, concerns, or you feel like something is there that's missing, please reach out to us. I know cancer diagnosis can feel like a long and confusing journey. So we have a supportive we are a supportive and professional resource who can help answer your questions. And we can provide reminders. We can be a steady person who can guide you through this journey. We can offer comfort and to you and your family. Navigators are usually the constant care team members who can also see the big pictures and can help you oversee also the symptoms, and we also respond to the total treatment needs. With our help, the patients will not miss appointments. We will address whatever problems are coming up in the earlier stages. We also decline the visits at the emergency rooms because of our involvement as well. There is a critical window of opportunity from the time of suspicious findings through the time when the finding is actually addressed as a diagnosis and treatment. So our generic goal is to break down those barriers that the healthcare system usually wrestles with in terms of providing timely access to care, ensure the patient stays connected and focused to the treatment plan that's established, and complete the cycle of care as recommended. So we recognize that every patient's case is different and it's unique, and that's the starting point of personalizing care. Our role is usually complex and starts with knowing your expectations, your limitations, your priorities, your values. So the ongoing plan of care that unfolds on a daily basis involves the right attitude toward the patients, the needs. We stay proactive. We offer choices, opportunities to improve your quality of care and give you confidence and a stress-free experience. The navigator aims to maintain a set of holistic standards and follows the patient's journey and also the changing needs from the time of diagnosis and treatment through survivorship. The take-home message is that we need to keep an open communication channel with the team and the navigators. So it's critical for the patient's outcomes, and that's why we need to hear your voice. We work with tenacity to solve whatever problems and you might encounter so that you can heal better, you can be more educated, you can have more control over your treatment, and also to reduce the suffering and discomfort. So together with the team, we evolve, we adapt, and we develop strength and resilience to overcome whatever challenges we might encounter so we can beat this serious disease. Thank you so much. My message is that we're always available. We are behind the scenes, but we feel for you. We try to understand what you're going through and help you as much as possible. We get the message to the doctor, to the nurse practitioner. We also refer you to other services, as I mentioned. So it's very important to keep this communication open. You will see us around throughout your visits, before or after. Sometimes we call you to ask you how you're feeling. So feel free to contact us. We are there on your side to help you as much as possible. Thank you.
Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.